As the reopening of tertiary institutions draws near, the Higher Education Ministry and relevant stakeholders are hard at work in trying to optimize the academic year under these circumstances. The Higher Health webinar was aimed at addressing burning issues and concerns surrounding COVID-19, as well as other health-related matters. The ministry has collaborated with experts and stakeholders to formulate programs and has also established task teams that have developed 9 protocols and guidelines to be used by all institutions.
Higher Health also provided numerous online and contact training sessions and has established a network of 30,000 trained individuals across all our campuses. These volunteers are given science-based training and understanding of the virus and are able to recognize and appropriately manage COVID-19 cases within campuses, faculties, disciplines, and directorates.
Nzimande adds that issues such as mental illness and gender-based violence also need to be prioritized.
Given the very important work that it has been doing, of course of late on COVID-19, but also what it has been doing on HIV and AIDS, on mental health, and a whole range of other health and wellness issues, that maybe together with our researchers, Higher Health needs to study its own data and to see what it is telling us about the state of wellness, the state of mental health in particular, in our institutions.
Health science students and campus health workers are among those who will be included in the phased vaccine rollout. The ministry says the sector could lend a helping hand in creating an efficient rollout strategy.
I urge our institutions and Higher Health to mobilize and capacitate our own healthcare workers, staff and final year science students to volunteer to be trained and act as extra hands supporting the Department of Health and our sector, of course, as it will be impossible for 40 million people to be vaccinated only by a single department. We need to play our part as a sector.
During phase 1, our priority group is health workers. So we know that there are health services being provided on many of our campuses, and those healthcare workers working in those facilities will be eligible for vaccination during phase 1B. Health science students, there's still some discussion about those, but particularly health science students who are in their clinical years and are therefore working in our health facilities are likely to also be included during phase 1.
The South African Public Colleges Organizations says despite its preparedness, the lack of resources to support different forms of learning poses a challenge. Student unions echo this.
There are challenges of comorbidities, lack of resources to support the blended learning, like laptops and data, as well as some colleges are struggling to support their staff members with the mental health or with the psychological support because of the limited resources.
We also need to remember that we saw a lot of confusion, also a lot of unrest with what happened with the issue of laptops and NSFAS and the 2020 academic year, which also put a lot of strain with student leaders, and it now leaves us to sort of have to answer questions that we ourselves are not equipped to answer because we don't have the answers from the department. So I think that I appreciate the presentations, but we need to then now be in a position where we look at our institutions.
The ministry says all TVET colleges have completed the 2020 academic year. Of the 26 universities, 16 are completing the year between now and March. Students will return to their respective institutions between March and April to start the 2021 academic year. Nasipho Mncube, SABC News, Johannesburg.